What is the risk for recurrence after surgery? Well, if one looks at the literature, the most important factor are what is the disease that the patient has when he comes to the table and how good is the surgeon. For example, when we do a prostatectomy, when we take the prostate gland out, we typically try to stay as close to the prostate as we can to try to preserve the neurovascular bundle. The neurovascular bundle, or the nerves that supply the penis for erection, run right alongside the prostate. And as surgeons, we peel those nerves off, much like peeling an onion skin off an onion, to preserve those nerves to allow men to have erections after surgery. The closer you are to the prostate, the higher the risk of recurrence can be. For example, if the disease is all contained within the prostate, a good surgical procedure is one that has negative margins, that's preserved the neurovascular bundle. That will help with the outcomes of continence, that will help with the outcomes of potency, and one has cured the patient. Now, in some cases, the disease may be outside the prostate. After surgery, the specimen that's removed by your surgeon is sent to the pathologist, it's dipped in a bucket of ink, and then it's put in formaldehyde and then sectioned and stained and looked under the microscope. And what the pathologist looks for is to see if tumor cells go right up to the edge, the cut edge of the prostate. If we see tumor cells at the cut edge, we have to assume that the disease, some disease was left in the bed of the prostate in the patient. And those patients, if they have a positive margin or if they have disease outside the prostate, some of those patients will require radiation therapy to get a cure. So the disease itself does play an important part in the recurrence rates in individuals, but the surgical technique also plays an important role. As surgeons, we want to get negative margins. We want the disease contained within the prostate, and ultimately, that's going to give the patient the best outcome.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.